let's talk about worksite wellness with MESSA. Now, notice I have 8 reasons. 8 reasons why you should recharge your work culture with MESSA. And I'm sure at this point, there's more. You have other reasons after listening to Dr. Hannah and to Dr. Amber and to Nikki. You have several reasons to start a worksite wellness program. You know, I was thinking about, why did I choose 8? So I had to think of some rationale behind 8, something deep. And I said, yes, there's 8 reasons, because tomorrow is the 8th, October 8th. That's one of the reasons. Right. Then something came to me and I looked at the calendar. Okay. And in 8 weeks, it's the biggest shopping day of the year. Yes, Black Friday, 8 weeks. And then this is the biggest reason, and I didn't realize this, just 8 came to me. If you count 8 months, including October, where do you get? You get to May, which is the end of the curriculum school year, because June we get out, right? You get out. So you have 8 months to implement these things, 8 months to implement 1 or more activities into your worksite wellness curriculum. And you guys, I know that's great. I thought of that this morning. There's always a reason behind things. So let's talk about some reasons. Support your health and wellness goals. Creating a worksite wellness program, a culture, a work culture that supports health and wellness, and specifically goals you have. So say, for instance, if you're considering going back to work and bringing some of these initiatives and you feel a little pressured as being the point person or potentially the liaison or the leader, think about some of your own personal goals for health and wellness. I'm sure your colleagues share those same aspirations. So it's easy to gather people, mobilize people when you're talking health and wellness. And I'll make it more specific: weight loss, lowering your blood pressure, controlling your blood glucose, things like that, losing inches off your waist, things like that. Creating a worksite wellness program, you can implement activities that can help you get to your goals. So often we start goals or we have resolutions on December 31st, and we're good until it gets time to go to work. You walk into the workplace and all your goals are out the window because the infrastructure isn't built to support your goals. So creating a worksite wellness program can help you do that. Improve your health behaviors. Our healthy activities can help you role model healthy activities within a challenge, either competitive or non-competitive. If you have a walking challenge going, that's improving your walking habits on the job as well as off the job. And we know when we engage in healthy activities, when we incorporate healthy behaviors within our lifestyle, most likely it's a high potential that our sick care costs will reduce, will minimize, and we'll spend more money on healthcare costs, things like our physical every year, our mammogram, and those visits to the doctors for things like our blood sugar being out of control or our blood pressure sometimes are minimized. So there's 3 reasons right off the bat. Supporting our mental wellness, not only yours, but those people you work with. At this point in the pandemic, they're saying the pandemic now is mental illness or the epidemic, depression, anxiety, and other types of mental illness. And it's what we know that is reported is 29.8% of Michiganders. And that's just people that are reporting it. So if that number could be greater for people who are not necessarily letting us know what they're going through. So a worksite wellness program is a great way to help people learn about mental illness, become more aware of the symptoms, and find out a lot of things they can do to help mitigate mental illness and disease. So different activities incorporating stress management, exercise, and nutrition, they all help with mental wellness. Other reasons to get a worksite wellness program started: create a sense of community. You know, since the pandemic started, people have been more isolated. It's not a lot of social engagement. We're getting better at it, but worksite wellness is a great way to create a sense of community at the workplace. And most of us are working 8, 10, 12 hours a day, especially school employees. So creating a space where people want to be there, where they're excited to come to work. Worksite wellness is the way to do that. You can make people feel excited to get to work because we are doing this type of challenge. We're doing a walk-in challenge, or we're having a recipe contest today, and just creating fond memories during the workday. Worksite wellness can do that for you. So if you feel like you hear your colleagues or some of your bargaining unit members talking about how they dread going to work, hate work, perhaps worksite wellness, implementing an activity can help out with that. So help your team members thrive. What does thrive mean? To flourish, to grow, to improve, having access to information, the opportunity to grow awareness, learn about risk factors, and have the resources. As MESSA members, we can help you do that. We have that information on our website. We have school districts that actually connect their websites to ours, or even some of the links to some of the important health information. And you could do that as well. So how do you get started? How do you get started? Well, I'm the person that you need. I am the health promotion consultant, and I'm a registered nurse. I've been a nurse for a long time. And actually, I was a nurse within the MESSA cardiovascular program and the MESSA medical case management program. But I also have experience in the hospitals, in home care, and various arenas in the healthcare system. So I feel like I have a good understanding of the healthcare spectrum from the beginning, which may start with the emergency room, to the end, which is more prevention and proactive. And our goal with MESSA is we want to help people gain their greatest health sense, their greatest health ability, if that's a word. We want them to reach their highest potential in health. And we want to help people that are challenged with chronic conditions minimize the complications, live their best self within even the chronic health condition. So I can help you mobilize a team. Show you how to do it. If it's just you, we can get started too. If you're going to be the wellness liaison, I'll work with you to create a curriculum or a program. But if you'd like to mobilize a committee, say for instance, a person from each building, if you're in an ISD, a person from each district, if it's just you in your elementary school, if it's you and maybe perhaps some teachers or some people from other roles, we can create a team and get moving. And I can help you build a curriculum. The great thing about having me is I work with lots of school districts, lots of people throughout Michigan, and I share my ideas with them. I also run headquarters wellness committee here at MESSA, as well as work with other teams. So you don't have to create things unless you want to. Why recreate the wheel? We share best practices with you and we make it easier for you. And actually starting this October, on the third Wednesday, we'll restart Wellness Pros, and you could be a Wellness Pro. Meet with me every third Wednesday, either at 7 a.m. or 4 p.m. You'll be getting an email about that. You can register for 7 a.m. or 4 p.m. every third Wednesday until June. We'll meet and we'll talk wellness, everything worksite wellness, personal wellness. We share ideas. There's wellness pros that are in the UP, up north, Eastern Michigan, Western Michigan. So this is based on your schedule. You can come in and we share ideas. I give you ideas, and we have topics for every Wednesday, but sometimes we go off script and we talk about other hot topics, and it's a great way to get started. I give you everything you need to get started. And we've garnered a lot of ideas from other districts. I believe that's how I met Melissa Van Brockland. She brought great ideas from her wellness program. So if you're interested in getting started, meet us at the MESSA Wellness Pro meeting or contact me. And if those times don't work for you, and we can find a time that we can meet together. Now, how do you get started? You want to survey people. You want to survey your audience, survey the people at your work site, or survey the ISD. Find out what people want to do. Find out where they want to meet. Find out their interests. Find out their communication mode. You guys know this as educators, as school employees. We start things with surveys. Now, we do know that if you decided, I don't have time for a survey, what should I do? Well, we already know people don't move enough. We know we don't eat right, and we know we're under stress. So if you work with those 4 principles, you'd be right in line with what is actually going on. But I like to help people by putting it in a framework of mindfulness, movement, nutrition, and starting with the survey, and you can customize it. So the 3 types of surveys we use are the health risk assessment, and that is for MESSA members. You can log on to the MESSA website into your member portal, and you can take the health risk assessment, give back feedback on yourself. It's private, it's confidential, and find out what you need to do to start your wellness journey. A health interest survey, this is something that can be used for all your employees, your staff, your colleagues. They don't need to have MESSA. This is something you create, and we have a copy for you, and you can customize it. So you find out the interests of your population. And also for our MESSA members, we can generate a wellness report card. This is a kind of a snapshot of your preventive care utilization, your healthcare utilization. It tells us in a confidential manner, an aggregate means of the percentage of health and wellness visits your population is getting, the mammograms, visits to urgent care. It's in a report style, so you and your program planners, your team, you can identify what are the things that we need to address for our district. Do we need to educate people to get their physicals every year? Do we need to educate people about going to urgent care versus going to the emergency room versus doing a primary care visit? The report card can help you do that. I'll take questions in the chat, but I can't see it. So if you want to unmute and let me know, that's just okay. That's just us putting in information.
Yes, how many people can be in there?
How many people can be in a wellness program?
Many or program?
If it's committee, as many as you like. It depends on your audience or your population. If you are contemplating a wellness team or committee, and you work with, let's say, a big school district like a Warren Consolidated, or like Warren Consolidated, and there's a lot of different buildings, I would suggest a committee with somebody from each building. If it's a smaller school district, maybe a committee where there's somebody for each role, say a teacher, a parapro, somebody from administration. It depends on the size of your audience, the people you're trying to reach. I hope that answers the question. So health risk assessment, again, that helps our members, and you are a member, and as a program planner, I can give you a report of everybody that took the health risk assessment, and it can show you how people fare in their health behaviors. It can let you know if people are eating enough fruits and vegetables, or if they are getting enough activity. And again, it helps direct the program planners. Here's a health interest survey. And these questions are customizable. And this is our snapshot of our wellness report card. We look at preventative care, annual visits, ER visits, and depending on where your school district is, I would talk to your field rep, and they can help you get more information if necessary, if you want to get even more customized. Now, planning resources. We just updated our Worksite Wellness Toolkit. We have a Worksite Wellness Toolkit that you can find at mesa.org. MESSA.org/wellness. Go out there, download it, put it on your computer, put it in your files, share it with your potential wellness committee. It gives you a framework behind worksite wellness. So we talk about mindfulness, movement, nutrition. All of our flyers that we share with you when we come out to your schools are located in this toolkit. So it's great to have on hand because you can use those flyers as a part of your campaign. Say, for instance, you're doing a campaign in February and you want to bring awareness to heart disease. There is a flyer for our heart disease nurse, our case management nurse that educates people on heart disease. You can use that flyer as a part of your information dissemination campaign. Paste it to an email or hang it up in a break room or give it out during a staff meeting, especially if all of your staff have MESSA. They need to know this information. And it's a great way to incorporate MESSA into your worksite wellness program and expose your employees that have MESSA to MESSA in this way, especially the MESSA health and wellness benefits. When you meet with your wellness committee, you want to plan out the year if possible. Say you want to really do something, you have 8 months left this year, pull out your activity calendar. We have one on our website, MESSA.org. Pull out the school calendar and just start filling in dates. We know that right now, November and December are big holiday months so perhaps an activity to help people avoid weight gain. We do one every year. We call it Avoid Weight Gain Challenge. And basically we just collect names of anybody that's interested in participating. And we send out motivational messages to help people maintain during the holiday. It's not a weight loss challenge. It's just, let's be mindful of our health and maintain. So we share recipes, we share encouragement to exercise, stress management tips, all things health, because we are not dieting through the holidays for sure. But definitely you want to track or at least get your calendar out and plan for the year. February, you want to do something for Heart Disease Month. April might be breast cancer. For those of you who like to plan ahead, and I know a lot of my educators are great at that, planning the school year ahead. So what kind of resources does MESSA have to help with you? First off, My Stress Tools. We've had this almost a year. My Stress Tools. And what this is a suite of stress management and wellness resources. When you log into My Stress Tools, you'll be taken to a different website. So you get to My Stress Tools through your My MESSA account. Okay, so if you haven't already created your account and have credentials, you want to do that. It's the same place you check your EOBs and your balances, but you log into your MESSA account. On the left side, you'll see My Stress Tools. You'll click on that, highlight, and you'll be sent to another website, the My Stress Tools website, okay? Now, this is the thing. If you try to get there from the internet, you won't be able to log in. Because you're a MESSA member, you can use it, but you have to go through the account. So once you get in there, I suggest you do what we call, let me see if I can do this. This is a test, you guys, of the internet.
While you're waiting for that, there was a question in the chat about the wellness report card.
Okay, what is that question? Okay.
Do you see it down there? It says, we usually get the wellness report card for our school district. The conference is in person. Will we get that this year?
No. Yes, when we used to do the conference, you used to come to our conferences in person. Wow. Yes, we did used to do that. Everybody got a report card, but when we have our next conference on site, we may do that. But if you're interested in getting a report card, let us know and we'll make sure you get it. Now tell me what you see on the screen.
Just the slide.
PowerPoint?
Yeah.
What do you see now?
There you go.
You see it?
Yep.
Bam. Here we go. So My Stress Tools. So what I did, you guys, so you'll know, you log in through My MESSA, Okay, on the left side of that screen, you'll see My Stress Tools. You'll click on My Stress Tools, a little box will come up and let you know you're going to another site. It'll take you here. I'm on a sample platform. So you'll see where it says welcome sample, it'll say welcome Rhonda when I log into my own. Okay, and the first thing you want to do is you want to take this profiler. Okay, so you'll come up with a stress number, and the profiler is profiling you. It's profiling what kind of stress you are under. So the various areas are control, support, change. Are you a person that can handle change? Financial stress, time pressure, worry and fear. I didn't score well on that. Anger, stress symptoms, stress outlets. I did good with that. Stress resilience, okay? And you will come up with a number, and that number will be right here on this right side. This number for this tester is 194, okay? So why is that necessary? What is the big deal about that? Well, this number, just like any number we get, it can be used as a baseline. So after getting your number, you go and you start doing activities consistently, taking the advice and the tips. You can come back in 6 months and take the test again and see if your number has improved. Are you actually learning information that you can incorporate into your lifestyle that is effective, right? So notice I'm at the menu, and you'll see all the different activities available on this platform. A daily journal. If you don't already have a journal, if you didn't receive a gratitude journal, you want to start journaling, this is a great place to do it. Now, what is the big deal about this? You can get a kind of a report. It'll let you know, it'll track trends. So you can view charts of what you are journaling. So that's why journaling is great, because it gives you an opportunity to reflect on what you're really doing, and you can identify trends and potentially identify stress traps and avoid those traps, okay? So that's what you can do with the journaling here. Brain training. If anybody was here with Dr. Hannah, you feel like you need to get your brain trained, then you can do some brain training activities here. That's like doing things that help your brain minimize the negativity bias. You remember she used that word, negativity bias? Sometimes when our negativity bias is too high, we're not very flexible. We don't have a lot of cognitive flexibility, and that means we don't see things, we're not able to see things as they really are. We become kind of rigid, and you got to get in this brain training and work on that. So if you notice, there are ways to learn, different modes of learning. So if you like to look and listen, there's videos. If you like to listen, there's podcasts, there's webinars, there's just audio only. Our book, Stop Stress This Minute, is here. Resilience Coach, Wellness Coach, and the Mindfulness Minute. Now, for you leaders, group leaders, for you potential wellness teams or wellness liaison, how can you use this, especially if you're not wall-to-wall MESSA? You're thinking, well, only I can use this. Everybody doesn't have MESSA. Some people are part-time. Some people have their spouse's insurance. That's okay. MESSA, we're about all-inclusive wellness on the work site. So what you can do, you can log in and you can pull this up on a screen. Say, for instance, you want to put wellness on the agenda at the association meeting. Log in, you would do association meeting every month. Log in on that day, tell them to give you a minute, 2 minutes on the agenda, and you pull this up. So you have potentially a whole year's worth of wellness curriculum for you right here. At each meeting, you're assigned to 2 minutes of wellness, log into the wellness coach. Or you can do the same thing with the resilience coach. You can decide, okay, we're gonna do a resilience challenge. Log in for 2 minutes, just put 2 minutes on the agenda, share it with everybody in the room. So that is our wellness, our resilience coach. Okay, I'm gonna X out of that. So I'm gonna stop sharing this. What do you see? What do you see?
There you go.
I didn't mean to do all that. Okay. So I'm gonna go back to my screen, keeping you guys alert. What do you see? They are up here cheering for me with this, you guys, in this room. This, you don't know how we practice this. They are like cheering. So that is My Stress Tools. I hope you visit that today or sometime this week, next week, and check out My Stress Tools. And the reason I need you to do it because I think it's helpful. The information is helpful if you want to learn about emotional intelligence, if you want to learn about cognitive restructuring, but also I need to know what you think about it, okay? We brought this on, it's been a year, and I won't know how well it works unless you go out and use it, and then I'll ask you about it and you can let me know what you think, okay? So I need your feedback on it. So case management programs, we have nurses that are specialized. They have additional training in chronic health conditions like cardiovascular disease, asthma, and diabetes type 1, type 2. Like I said, I used to be the cardiovascular nurse, and I built the hypertension program, actually. Kathy may be in a space, our cardiovascular nurse. She's doing a great job with that program. This is for our members that are struggling with these chronic conditions, and you need somebody to help walk you through what is necessary for a healthy lifestyle. Exercise, medication understanding and compliance, stress management is key in a lot of these things. So these nurses are available for you. They do outreach for people that are very vulnerable. Say, for instance, you are in the hospital or in the emergency room often because of this condition, not having it under control. They'll reach out to you. They'll send a letter or they'll call you and invite you to participate. Otherwise, we don't do a lot of outreach with it. So if you have a family member on the plan that needs some help with their blood pressure or their blood sugar has been out of control, perhaps this may be the answer. If you are thinking about doing something at the work site to expose more of your colleagues to their MESSA benefits, doing a campaign where you are sharing the flyer, perhaps on the in the break room, or a wellness tip every Wednesday. And one of the tips might be you just paste this flyer out and tell your colleagues, remember MESSA has this for us if we have these chronic conditions. Anytime you are disseminating health information, you are a wellness team. You are a wellness pro. It's just simply sharing information, and we try to make it easy for you to share this information with the MESSA members. OMADA, that's one of our programs that we are very proud of. And like I said, we're passionate about preventing chronic conditions if we can. At this point in medical technology, medicine is doing a lot lately, but at this point, there's no cure for diabetes. However, there's a lot of information teaching us what to do to prevent it, or if we're at risk for it, delay the onset, right? We want to eliminate the risk altogether. So that's why we brought on OMADA. This is a digital program. You can pull up the app on your phone. If you want to engage on your PC, you can, and I think you can even engage telephonically if you like, but it's about lowering your risk for type 2 diabetes. Type 2 diabetes is the lifestyle diabetes. You develop it as we get more chronologically mature. So what you do is you take a questionnaire to find out if you're at risk for it. If you're at risk, if this is a free benefit, they send you a scale, a digital scale, and you're assigned a health coach. And this health coach helps you to understand how to manage stress, the importance of movement and how you can start doing it, and the importance of nutrition and how to make good food selection. It's not a diet. It's similar framework if you've heard of Noon. I hear a lot of people saying they got Noon. I've been at different lunch and learns talking about OMADA, and people are saying, yeah, I did Noon, and that's how it kind of reminds me of Noon. Well, Noon is great, but Noon you'll pay, okay? With OMADA, it's free for our members who qualify. So for your husband, for your wife, your spouse, your partner, anybody on your benefit, your plan, they're eligible for OMADA. Livongo, another product we have available, this is for members who have already been diagnosed with diabetes type 1 or 2, children and adult. This is helpful for you if you need supplies. It can reduce the cost of diabetic supplies, and also provides information. Now, like I said earlier, if you have an issue with diabetes, we recommend our MESSA nurse who gives personalized help and guidance with that. She's a certified diabetes educator, but we also have this available too, which can supplement that. I see my chat number on for, is that any questions in there? Digital tools, you guys, everybody's digital, so you know how to find information on MESSA at mesa.org and /wellness. You go down the column, all the wellness things I talk about, I share, even our videos from past conferences, you can find at MESSA Wellness. And we save them because you can use them as a part of your wellness team. Download it, show one of our presenters that presented on mindfulness or nutrition or movement as a part of your wellness team at a staff meeting or an association meeting. Definitely go like us out on Facebook, Twitter, and YouTube. And if you haven't already, if you are into apps, download us on your MESSA app. Right? So let's talk about some different things you can do. Now, remember I said mindfulness, movement, nutrition, and that's how we structured this conference. So we got our mindfulness information from Dr. Heidi, movement, some great stuff from Amber, the 6 fundamental movements. I can think of an activity you can do right now or get ready to kick an activity off in April, the 6 fundamental movement challenge, and create a spreadsheet, and there you go, 30-day activity. But mindfulness, say for instance, you want to address mindfulness or some principles from mindfulness, some different activities from mindfulness. A Monday mindful email message, right? And you want just short messages, and you're thinking, well, what can I use for a mindful message? Go to My Stress Tools, see that mindful minute, and go put it on your mindful Monday email and send it right out. Make it that simple. Mindful movement activities, your 30-day resilience challenge. Again, what do you do for your 30-day resilience challenge? Just go borrow it from My Stress Tools, and you'll have the information you need. And I have that on here. Movement, everybody loves to do walking challenge. Walking is probably the best type of exercise you can do. It's low injury, low impact, easy to do anywhere. You could go outside and do it. You can walk around the building, within a building. You can go to the gym and walk on a treadmill if you want to. I love walking outside when the weather is supportive. So walking is the best type of movement, and it's so easy to build a walking challenge. We have a push-up challenge on our website that you can use, a 30-day push-up challenge. Also consider contacting your area fitness centers, your area personal trainers. Sometimes they just want the exposure, or they want to help out, and they'll volunteer their time and their skill to come to your school and do some demonstrations, to share some information. You could use that as part of your wellness program if you find from the survey that many in your population need to work on movement or want to work on exercise. I'm hearing a lot about back pain. People want to address back pain and flexibility. Dr. Amber is available, but also within your area, there's physical therapists and chiropractors that would love to come out to your district and talk to your group, to share some information and do some demonstrations. Actually, I'm gonna get that for our Worksite Wellness program here. So consider that as a part of your movement plan. Just looking around to see if anybody's giving me any keys for anything. Any questions in the chat for me? I'll keep moving. And nutrition. A meal preparation demo, perhaps bringing somebody in to do a cooking class. Now we have Nikki, we know her services are available. Recipe exchanges. What we did at our Worksite Wellness program, we did a monthly recipe contest, and we categorized it. 1 month we did desserts, 1 month we did appetizers, 1 month we did the main dish. And at the end of that, we created a recipe book. So we have a very comprehensive recipe book that our members created, our colleagues created, and we just put it in our file. So that's a great way to engage people. And I'm telling you, out of the three, mindfulness, movement, nutrition, everybody loves to talk about food. And they love to talk about food in a way that you can make it healthy and make it where it is nutritionally dense, but low in calories. So if you want to engage your population in worksite wellness, kick it off with something that has to do with food. We're moving into the colder months. Everyone loves chili contest, your healthiest chili contest. If you're on site, that's a great way to engage people. People love to come and eat. Newsletters, including healthy recipes in a newsletter. And if you consider a newsletter, you want to send it out maybe quarterly or 4 times a year. Just a couple of things, a page or 2, no more than that. People don't want to read a dissertation, but they just need quick bites of information to help them move along. And there you have it. Any questions about starting a MESSA Worksite Wellness Program? Chili cook-off, I see that. Well, I wanted to share with you. Now, you know, I go out to schools and I help people start worksite wellness programs. I work with education associations as well. I have today, I'm so tickled that she agreed to come share with me today. Melissa, are you there?
Hi, Rhonda. I am. Can you hear me?
I can hear you. We're gonna put the spotlight on you.
Aha. All right.
Is it just you or you and Christy?
Christy's on. She's just not at my house.
Okay, Christy's on. We'll make sure that if Christy has anything to contribute to this. Now, I love Melissa and Christy. I don't know how long I've been working with WarrenCon, but it seems like a while now. Yeah. But tell us about you and what you do and how you got started in wellness, Melissa.
So I am currently a 2nd grade teacher in Warren Consolidated, and I've played sports my whole life. I've kind of always been interested in, being active, and it's kind of been instilled, from family members and friends. And when I joined WarrenCon, we did not have a, wellness team. And about 5 to 6 years ago, they asked us our union actually put it together. And they wanted to make sure that we were using all the benefits of our insurance and, getting people out and active. So we started it. Right now, there's only 3 of us on the committee, but honestly, with my amazing sidekick, Christy, she, is also very involved, and she's able, her and I are able to put wellness out into our 830 members.
Wow, I was just going to ask you how many members, 830.
About 830, yeah.
Yeah, and I think you guys were the first group that I did with, not necessarily a district, the association wanted to start a wellness. So actually the association created a position called the wellness officer. Is that right?
Correct. Yeah.
So you can do, if it's just you in an office building, or you and a group of people in a room, you want to do wellness, you can do that. If it's the building, you can do it, the district, or even the association. It's a great way to bring wellness to your association members. Now, what kind of problems did you guys identify that made you think you needed wellness?
So, problems that I wrote down were kind of that, at the time, people can be overwhelmed. It's either, unfortunately in Michigan, right, we only have our, extremely nice days from September until, the end of October. Nobody wants to do anything really between November and, March. And then we have spring, and it's like the beginning of school and the end of school, which are the 2 most stressful times. So, I think that, participation was one of them. And kids, a lot of people have children that, their activities are on the weekends, and we tried to do, activities on the weekends. We tried them after school, and that's, kind of family time for everybody. And, unfortunately with our profession, with teaching, we can't have like a district, the district will say, hey, we're all taking a day and we're going to go and do, like as other companies and corporations can do, like Habitat for Humanity, or, they do like like you said, kind of like a lunch and learn, or, we can't do that as a district, as our profession. So I think that those are kind of some struggles that we have.
Okay, good, good. This is helping. So what did you end up coming up with? What kind of activities did you guys do?
So in the past 5 or 6 years, Chris, last year, we kind of moved our Facebook page over from wellness to health and wellness.
Mhm.
And Christy is manning the Facebook page. So we have a Facebook group where we invite all of our members, and she's been posting healthy recipes and just kind of different activities people can do. Like you said, walking. We have walking challenges every single year, and that definitely seems to be the most participation, for sure.
Okay, cool, cool, cool. Walking challenge.
Yeah.
Excellent.
I have
Now,
a couple more.
How'd you guys set up your walking
oh.
challenge?
So our walking challenge was with you. You really helped us, set it up and just kind of get everybody involved and send out the emails and, kind of get a goal for everybody. And then, that was kind of nice. Start small. Even if you're out there and you have 5 people in your participation, you're still incorporating it and you're impacting 5 people. I mean, that's better than 0. So, we definitely have found out, like, I know I'm going off topic a little bit, but our golf outing, we had, about 15 to 20 members in our first annual golf outing. This year, in our second annual golf outing, we had like 30. 35. So, each year we're planning on getting it just a little bit bigger and bigger and bigger. But back to, our walking challenges. We decided last year to do a little friendly competition between other districts. And that was when you helped us get everybody else involved, and we had a friendly competition between districts, which was a lot of fun because that really motivated people.
Absolutely. Okay, I remember that too. And actually,
Yeah.
that was associations, but it was districts.
Yeah.
We brought in a lot of people too.
It did, a lot of people. Yes.
Now, have you seen any issues or heard of issues with mental wellness recently?
Yeah.
And
Yeah. Mm-hmm.
people more depressed and anxious? Do you think wellness is helping? The worksite wellness activities are helping?
I think that anytime that you're being active is when you're clearing your mind. Like you said, whether it's music, whether you're just out taking a walk, a nature walk, I have learned, that I don't always have time after school and on the weekends to think about things for myself. So I'm noticing that, like, I take my students on a nature walk instead, to get them out and active and, take a look, at the leaves, how, pretty the leaves are changing right now.
Right.
Another thing that I incorporated is when they're at recess, I'm walking. So I've pretty much gotten almost 2 miles a day extra just because I take them out to recess morning and afternoon and we're walking. So that's my best way of motivating everybody, and my team does it too. My second grade team walks with me.
Oh, perfect.
Yeah.
So it has you reaching your goals and changing your behavior, and it's helping the people around you.
Yep. Mm-hmm.
Excellent. So you have any tips for anybody in the space that is considering worksite wellness? Because sometimes it's scary to take on an endeavor like this, an initiative. You think it's going to be too hard, you're going to give up. What can you help? What can you tell?
Yeah, definitely. I mean, like I said before, I think that start small. Even if you're impacting 5 to 6 people, you would be surprised at how happy people are when you're actually, we met at Pink Creek Trail, which is in Rochester, a couple of years ago, and we did a Saturday walk. It was a couple mile walk. Everybody brought their kids and their dogs, and then they met after lunch, and we had a healthy lunch there. We all ordered salads, and we gave out a couple gift cards, $5-10 gift cards here and there, and people were so thankful. So it can be something very small, or it can be something big like a golf outing. you know, you can find people that have common interests. And, you know, it really helps when you are our motivator because you're always so positive. And so when you are positive, it comes back on us as being positive. And, you know, that's always, you know, something that people, when you're positive, people want to be around you. So.
Well, thank you so
Yeah.
much, Melissa and Christy.
You're welcome.
Put a comment in there. The walking challenge is awesome. Thank you so much. You guys do a great job with this, what you're doing. And look, I'm gonna show you this. Because every conference, I try to get a school district to come and help out and share their experience, right? Thank you for volunteering. You and Christy are going to get a gym bag,
Aw,
a
thank
and a
you.
water bottle in it to keep your wellness going. So thank you for your wellness work that you've done, okay?
Thank you, Rhonda.
You are welcome.
Yes, thank you. That's so nice.
Thank you, Christy. Thank you both.